Hey everyone, my name is Christian Carino and I chose to do my project on Parkinson's disease. The main reason why I chose to do it on Parkinson's disease, this picture kind of explains why. This is my grandma who passed away from Parkinson's just a few years ago in 2018. I believe she faced it for over 10 years. So I really just wanted to learn more about it, about the causes, the symptoms, and any interventions that I would have been able to do if I knew physical therapy at the time. So first, we'll just be talking about Parkinson's and the basics of it. So Parkinson's disease is a condition that affects the basal ganglia in the brain that results in movement and behavior dysfunction. The basal ganglia are groups of gray matter within the cerebrum that are a part of the extrapyramidal system that controls our movement. Parkinson's disease affects approximately 1% of people over the age of 50 in the US, with about at least 500,000 people living with this disease currently in the US. It also affects more men more than women and is more common with aging. There's also two types of Parkinson's. There's primary Parkinson's disease, and then there's secondary. Primary Parkinson's disease is what most people are diagnosed with about 80 to 85% of diagnoses of Parkinson's being primary. Secondary Parkinson's disease causes motor symptoms that are similar to primary Parkinson's, but the underlying biological cause is different. So, next we'll be going over the causes of both primary and secondary in the next slide. So, next we'll be going over the etiology and causes of Parkinson's. So, for primary Parkinson's disease, the cause is unknown, but they believe it may be hereditary, being linked to the alpha synuclein gene, Parkin gene, DJ1 gene, PINK1 gene, and the DRDN gene. As for the secondary Parkinson's disease, it can be caused by infections, drugs, or other toxic reactions, cerebrovascular diseases, and trauma or brain tumors affecting the basal ganglia. Risk factors for Parkinson's seem to be greater in industrialized areas. Therefore, farms and agricultural workers were found to be at greater risk. This also led to the conclusion that exposure to pesticides may be an environmental cause as well as viruses. So now we're going to look at the signs and symptoms. Usually, in patients with Parkinson's disease, you'll see them tremor a lot, whether it be in their hands, arms, legs, jaw, or their head. They may tend to have a lot of muscle stiffness, which means it remains contracted, and they may have muscle atrophy, bradykinesia, and akinesia. They also have a slowness of movement, impaired coordination and balance, which also makes them prone to falls. They have a shuffling gait pattern. They have cognitive impairments and speech problems. They also have difficulty initiating movements, and some patients with Parkinson's disease can also face depression, probably due to the fact that many of these signs and symptoms can be very overwhelming when you have them. Okay, now next we'll be going over the medical interventions for Parkinson's. So some medical interventions may include trying to increase the level of dopamine in the brain, and they tend to do this by using levodopa. So levodopa is a central nervous system agent that is converted into dopamine in the brain, and it helps alleviate the symptoms of Parkinson's. Um, they may also use anticholinergic medications, which helps reduce activity of acetylcholine and may reduce tremors and muscle rigidity. Another common medical intervention that they use is deep brain stimulation. Deep brain stimulation usually involves the implantation of electrodes into the brain, and it may be helping reducing tremors as well. as movement problems. Other interventions may be speech and language pathology. This is due to um, their loss of being able to speak, which my grandma also had. A lot of the times when I seen her, she wouldn't be able to talk uh, and would barely be able to respond. Other therapies can be either occupational therapy as well as physical therapy. And then last one that I wanted to include is CBD. I had a video about CBD that I wanted to show, but unfortunately, my presentation couldn't play the video within it. But it was basically about a patient who had Parkinson's, and they gave him CBD, and within the next few minutes, um, his tremors and his speech came back. His tremors went away. So then, this video that I saw, it also reminded me of my grandma a few years ago. A few years back, we would always give her CBD as well, as it would help a lot with a lot of her symptoms. Usually, when we went to see her, she couldn't walk on her own, she couldn't get up on her own, and she would always have tremors. But I remember one time when she took the CBD, she was able to stand straight up from her chair. She was walking around by herself without her walker, and she was able to speak a little better and respond to us as well. So the video basically showed the same thing, but it was unable to pull up. So I was actually able to find a way to edit in the video. So here it is right here.
Hi, Larry. How are you?
Come in, come in.
Good to see you. How you feeling?
It's been a bit of a rough week.
Really? And the best way to take it is put it under your tongue and rub it in your cheek. Don't do too much. You're going to be asleep all afternoon. You know what you should do?
No.
Don't try to communicate. Just relax. See what happens.
We know from animal experiments that the endogenous cannabinoid system is very important in regulating motor activity, that very type of activity that is impaired in Parkinson's disease. From animal experiments, we also know that boosting certain branches of the endocannabinoid system is helpful in relieving symptoms.
All right, next, what we'll be going over is the physical therapy interventions. So, a lot of the times, physical therapy interventions may include relaxation techniques. This is to help increase the exertion of the ribs and helps with maintaining mobility. PT intervention may also include gait, balance, coordination, and strengthening exercises to help with the symptoms that they may face. And assistive devices are used as necessary. I believe usually they're walkers or rollators, which my grandma had both of those. This is to help with their coordination and balance, as well as just being able to sit down since they may have lack of endurance. The intervention may also include hot, moist packs, electrical stimulation, and shortwave diathermy. This may also help relieve their pain and help with relaxation of their muscles. And then I believe the main goal for PT intervention for Parkinson's disease is to help increase joint range of motion, increase muscle strength, and also improve endurance and cardiovascular function. And then last but not least, what we'll be going over is just a summary of the study that I chose. The study I chose was on the effects of physical activity in those who have Parkinson's disease. Their objective was to highlight the parameters that are most likely to see improvement in Parkinson's when being physically active. Their methods consisted of performing a study of over 40 years on almost 900 patients with Parkinson's disease. The findings of the study supported their objective as they found that physical activity was most effective in improving the physical capacities and physical and cognitive functional capacities, although is less efficient in improving the clinical symptoms and psychosocial aspects that come with Parkinson's. In conclusion, this study supports the use of physical therapy and physical activity for functional capacities, as well as cognitive functional capacities, although it is not recommended for improving symptoms and psychosocial aspects that patients with Parkinson's disease may face. And here's my references, and that basically concludes my project on Parkinson's disease and how physical therapy can help them improve.